Rural communities in Nigeria often tend to be neglected and lack basic healthcare facilities. This has provided the reason for the Niger Foundation Hospital to start the Iwollo Rural Health Centre in 2003. The health centre is situated in Agobo, Iwollo in Eziago local government area, about 45 minutes drive from Enugu City.
No, because at the beginning also, coinciding with the ideas that Don Alvaro have told us, besides the hospital or the clinic in Enugu, we were trying to help other communities, and we went to the Ministry of Health to see certain communities that were very much lost in the bush and they could not reach. So we started by taking one by one a number of these places, some settlements, and going there once in a month to give free vaccinations to all the children and do later on some screening on diabetes, on hypertension. Now we visited a good number of them, definitely after a number of times all the children were vaccinated. When the conference center was being built, also as a way to thank the people in that community that had facilitated the land, and we saw also then we will do there a rural clinic and we will focus in that place instead of going to different places each time. So in that way the rural clinic started in the grounds of the conference center.
In this clinic, we render all sorts of services that anyone can obtain in any standard clinic.
First of all, when mothers come, we welcome them, give them seats, attend to them, check their blood pressure, check their weight, their temperature, their pulse, and then find out if there is any problem at all.
An important aspect of the services offered are health talks on topics related to health awareness, proper hygiene, and management of basic health needs.
We introduce good personal and environmental hygiene. Teach them how to prepare their meal, wash their hands before food.
So, eku nina yechi wata kidala, nina yechi ala steady no na da mba yota karịa na ị na-akpọ ya ala na ala the best thing feeding well in a young man's.
Famutara ebe a mbukwara ibu ọ na-achapụ amụọ nwa ebido from bido amụrụ nwa na-enye nwa ala until nwa eme a year and before akwụsị ya ala.
Among the services provided to Iwollo and its surrounding communities are free medical consultancy and heavily subsidized and, where possible, free medication.
Immunizations here are free. Then the drugs we give to outpatients are given at a subsidized rate. So we don't give 100% of what they are supposed to pay. We reduce the cost at a price that is going to be affordable for the patients and a very good drug as well.
In fact,
the hospital also provides vaccination services, most of which are offered free.
It has been very helpful to the people because initially when we started, we used to have a lot of patients with a febrile convulsion, children, sometimes 2 or 3 a day, brought with convulsions, very high fever. Usually the parents have tried all the remedies they have in the house and they are not able, so they'll bring the child to the hospital, usually very dramatic. They are anxious, they don't know whether the child will survive, whether the child will die, and then we have to leave everything to attend to the patient. These days we have fewer and fewer of those cases, so that shows that the parents have learned with our medications and also with the health talks that we've been giving them to try and bring their children to the hospital early enough when they have fever and also to give other little remedies like a paracetamol to bring down the fever. Also, we used to have patients who come with very high blood sugar. They are diabetics, but because they are not taking medications, the sugar is usually very high. They have all kinds of complications, leg ulcers and wounds that are infected, discharging. We have to really do a lot to treat. But right now, the people are very happy. You can see the effect of the medications on them. They usually expect us when we come. I mean, when you look at their faces when the Iwollo team arrives at the gate, they are all waiting patiently. Some of them have to trek 1, 2, or 3 hours to get to the hospital, usually very early in the morning. And they usually stay at the gate to wait for us. So when the team arrives, you can see the joy and excitement, in their faces that they are going to be treated today. So I think it's really been beneficial to the village and even the surrounding communities. So I would say that it's quite useful for the people, especially some of the free diabetic programs that we run in Iwollo, and then we give them a health talk, health education, which is very important because sometimes they don't know that they need also some dietary restrictions to control their blood sugar. So, and they have really done very well, and most of them have their blood sugar controlled now.
The health center was built and is sustained with the help of many generous donors. It is one of the main efforts of the Niger Foundation Hospital in the area of improving healthcare provision to rural communities, as well as contributing to the overall quality of life and socio-economic well-being of disadvantaged areas, with particular reference to women and children.